Welcome back. Today is Medical Monday, and joining us in studio today is Orthopedic Surgeon at Hurley Medical, Dr. Travis Baes. Good morning.
Good morning. Thanks for having me.
Yeah, thanks for being here. You know, as we enter this last phase of summer, so many athletes out there gearing up to return to the field or the court. Let's talk about injury prevention and, what's at top of mind for you. So I'll let you have the floor. What do you see typically as we head into the fall season?
So yeah, absolutely. I think there's a few things that we can talk about. One of the things is that what are the at-risk injuries that can happen with certain sports? And we kind of see that in two folds. One of the folds is that athletes that are at increased risk for an injury that might occur across all sports, but at a higher prevalence or incidence. For example, our female soccer athletes being at a higher risk than their male counterparts.
Okay.
Or those types of injuries that occur from kind of repetitive overuse activities and athletes are playing a single sport all year round.
So with that in mind, you talk about, being repetitive in some of your emotions. What are some things that athletes can do to prevent injury?
So I think one of the biggest things we could talk about with youth athletes specifically is diversification or cross-training. So I think there's been a big push in recent years for athletes to do a single sport. We call it single sport specialization. And it's happening at an earlier and earlier age. And that will be one athlete focusing on soccer, let's say, or baseball for all year. And so the risk with that is that you're doing this same repetitive motion, putting stress on the shoulder or the elbow, and you're doing that without taking any breaks off. And I think the idea behind it is a lot of people thinks it gives them the leg up in terms of getting into kind of a higher college play or over the competition, but really that's not been shown to be the case at all. What we really see is that cross-training or diversification, meaning playing multiple sports, especially in our athletes under the age of 14, not only does it improve kind of their overall athleticism, focusing on balance, coordination, strength, proprioception, those types of things that make them a better foundational athlete, it actually reduces their risk of injury. So single sport specialization is associated with higher risk of injury, both kind of acute and chronic.
So diversify when it comes to training.
Yes.
What about when it comes to treatment options themselves? I mean, talk about what you see and how you're there to help.
So I think the biggest thing for me is that, we always want surgery to be the last ditch effort, right? So as much as I enjoy doing surgery, I really want to get my patients better without having to intervene. And so with that in mind, I think the biggest thing we can do is prevention. So implementing programs to kind of avoid that. So there's great things, for example, for baseball players, right? We have pitch counts. So MLB has something called Pitch Smart, which you can go online, coaches, athletic trainers, they can all access it, and you can see for a given age how many pitches should we be throwing, and then how much time off should we have in between those. Or soccer, for example, FIFA has FIFA 11, which is kind of this warm-up and dynamic program that you could, again, coaches can easily access it online, and you can implement it into your training program, and that's been shown to reduce injuries. And so, although we're here, if, you really need us, try not to need us.
Yeah, that's great advice. Again, that's great that there's resources out there too that people can take advantage of. And if you do need some injury treatment, you're in good hands with Dr. Travis here. There's more information on your screen. You can go to hurleymc.com to learn more. Thank you for coming in this morning.
Absolutely. Thanks for having me.
Yeah, and stay safe out there on the field and the courts.